All right, you going live? All right. Are we live?
I believe so. It's flashing red. I just got a message from Brittany saying, okay, she said we're live. We're ready.
All right. Hey, welcome back, everybody. Hi, my name is Kendra King. I am one of the GCAP Youth Advisory Council members, and I have the pleasure of introducing Ms. Septima Riley. Now, Ms. Riley has her degree in uh, neuroscience. A bachelor's of art with an interdisciplinary in neuroscience. She works as a clinical. I'm sorry.
No, you're just fine. Lost Kendrick for a second, guys. I thank y'all so much for being patient with us. It's sort of going in and out a bit. I can share my screen from here. We'll give Kendrick a couple more seconds. And if he's still having some issues, we'll share and just sort of get into the meat of things. Let's see. Let's go here. 1 second. And we'll start. I do have a slide here just in case we had some issues there. But what I'm going to talk to you all about today, our topic is Let's Talk Trauma, how to identify it and manage the impact on the lives of teens and adults. I have my notes here. I also have my phone down here so that I can see your comments as we're going. So feel free to comment as we're going. If I don't see it, if I happen to be looking up there, then there's a moment at the end where I'll circle back and view the comments. So feel free to wait until the end or to just put them there so that we could thumb through them towards the end of the session. So as Kendrick was explaining, I'm currently serving as a clinical evaluator at DeKalb County's Misdemeanor Mental Health Court. I'm a double dog, go dogs, UGA through and through, red and black. My bachelor's is a bachelor's of arts in interdisciplinary studies with a focus on a psychological focus on neuroscience. I'm getting tongue-tied here. And my master's is in social work. So that is the framework of the information that I'm bringing for you today. Most importantly, my research has centered around how complex trauma impacts our bodies. So physiologically, understanding how trauma can have some long-term effects on us, be it psychological or physiological. And so that's my frame. That's where I'm coming from. That's, literally what drives me to do what I do. My area of concern is looking at how that complex trauma may affect the well-being of Black people whose lived experience involves things like systemic racism, poverty, and or abuse. And so you'll understand a bit more today about complex trauma and how, it takes several things that could eventually affect us. So moving along, I may go back and forth if I don't see your comments, but I want to know who knows the basic definition of trauma. Anybody can hop in here. Let's see, I may have to come out of here so that I can see you. Let's see. Does anybody want to take a stab at it? What do you believe the definition of trauma to be? Okay. I don't see anything there, so we'll move along. It's no worries at all. Okay. There we go. So y'all may have seen it if you were looking at the screen here. And trauma is a deeply distressing or disturbing experience. We'll talk a bit about trauma, what it looks like, ways for you to be able to recognize it, ways for you to check in with yourself to be able to identify, what you're feeling and whether what you're feeling is traumatic. And that's, subjective. That's completely based on your experience. We're going to talk about that as well. I do want to give a disclaimer. It's very common, when we're listening to symptoms about diagnoses, be it diagnoses that are caused from trauma or not, for us to be like, okay, wait a second, and sort of self-diagnose. So, if you have some of those wait a minute moments, that's completely normal. I don't want to freak anybody out. The purpose of today's session is to be informative. So if there's something that sticks out to you, definitely take note of it. But I just want to warn you so that, we all don't leave here today like, okay, what's going on with me, and sort of going into panic mode. So that's completely normal. The information given out today is not meant to substitute sound medical advice. If you feel like, there are some things that came up today that are concerning for you, most certainly reach out to a medical professional or clinician. And I'm going to provide some resources towards the end of today's session, just so that you be able to, see what applies to you if you want to reach out to someone. So we'll talk about that a little bit later, but I wanted to make sure I put that disclaimer out there because that's very, very common. Let's see. So as I described, there's what we call big T and little t. We all experience traumatic events. And as I said, it's really subjective on how you view them to be and what that experience is like to you. A lot of my research is based around what we call ACEs. And that's adverse childhood experiences. And those type of traumatic events tend to cause the most harm per se, or have the most, I'd say, like long-term effects on our bodies. So we'll talk a bit about that as well. But I definitely want to dig into the 3 types of trauma. And the first type is acute trauma. And acute just means it results from a single incident. So that could be, an accident, an injury, a violent attack, be it by another human being or a dog or anything, an animal. That would be one single event that could be traumatic. And then there's chronic trauma. And chronic trauma is repeated and prolonged trauma. And that's going to be something like domestic violence or abuse, or living in a crime-ridden neighborhood, a life-threatening illness, being repeatedly bullied, experiencing childhood neglect. Like, those are things. Chronic just means repeated, something that is prolonged and happens more than one time, like a series of events. That will result in chronic trauma. And then there's complex trauma. And so complex trauma is when we are exposed to varied and multiple traumatic events. So it's often of an invasive or interpersonal nature when you experience complex trauma. So it could be, a combination of living in a crime-ridden neighborhood, experiencing domestic violence, experiencing a violent attack. So it's when you experience multiple types of trauma. And so some commonly overlooked traumatic events could be death, especially if it's sudden. A lot of times we want, it's like, when will I get over this? And, will it get better? Does it get better with time? And some people say, no, it doesn't. And that's because it could have been very traumatic for them, especially if it was sudden, and your body will begin to respond in that way. Significant breakups can be traumatic. If it's not expected and you experience some form of neglect afterwards, that could definitely be a traumatic event. Being humiliated or a deeply disappointing experience, that could be traumatic as well. So as I said, trauma is very subjective. It really just depends on our perspective as we're going through those events. Let's see. So I have another question. If y'all haven't noticed, I'm very call and response. So working online, as we're all navigating COVID-19 and things like that, has definitely been a learning curve for me, because I typically be asking y'all questions face to face. Let's see if I may exit out of here just so I can see, because my secondary device is not pulling up your pulling up your answers here. So there we go. I think I was on the wrong ones. Let's see. Okay. So, question. Can severe childhood stress cause adult stroke, cancer, and Alzheimer's? What do you guys think about that? Okay. Ebony says yes. Okay, as does Brittany, Stacy. Thank you. Thank you, Julian and Rebecca. Okay, y'all may be able to teach this. It looks like y'all are on it. Thank you, Tiffany and Elizabeth and LaCara, Dion. Thank you. Okay, so let's go back here. Play from current slide. Y'all were right. Yes, it most certainly can. This chart here is very informative. And it's eye-opening. You know, when I first started this research, a lot of it was grounded into just really understanding. You know, you hear about certain populations, especially impoverished populations, that experience higher levels of things like Alzheimer's and, you know, stroke and cancer, things like that. And it was very puzzling to me to understand, you know, as this lifestyle, it's sort of like, you know, understanding which came first, the chicken or the egg, right? You know, like what's happening here. And an author who I truly adore and look up to is Dr. Nadine Burke Harris. She's based out of California, and you know, her research is the ACEs, the adverse childhood experiences. And so, you know, it was her experience that has informed a lot of us, you know, who are in this area to understand how trauma affects us, affects our bodies. And so this study here was a survey with the CDC and Kaiser Permanente. They surveyed 17,000 of their members that were on their health plan to determine whether they'd experienced adverse childhood experiences. And so as far as abuse goes, that could be psychological, physical, or sexual. Another type of adverse childhood experience could be neglect, be it emotional or physical. And then there are household challenges. This is another thing, like we talked about earlier, the uncommon types of trauma that we don't really give credit to. You know, you're sort of going through it and not really understanding why your body is responding that way. And that's because, you know, your body is throwing off red flags saying, hey, this is a lot, you know. And so household challenges could be a family member who's experiencing domestic violence. That could be like secondary trauma, having to live through that and witness that. Mental illness, having a family member who's experiencing mental illness that could cause you to experience neglect and or abuse as they navigate how that impacts them as a parent or as a family member. And imprisonment. My very first research study looked at the psychological effects of the family unit for individuals who were incarcerated. You know, of course, we can think of how incarceration can be very scary and, you know, isolating for the individual who's incarcerated. But there are some long-term effects that happens within the family when the family is having to navigate incarceration. So that study was eye-opening, as have most studies been on ACEs, because it found that people who experience adverse childhood experiences had a higher risk for things like heart, lung, and liver disease, had higher risk for obesity, higher risk for diabetes, depression, and substance abuse. And a lot of times we see that, and I see that in my current role where, you know, by the time I make contact with individuals, it's typically after they've been arrested. And so a lot of times, if they've not been connected to care to address the trauma that they've experienced, I see a lot of self-medication with substances. And so we don't have time to dig really deep into that today, but, you know, most certainly if you have any additional questions or, you know, just really curious about this, check out The Deepest Well by Nadine Burke Harris. Very informative book, and it's not very scholarly per se. So it's easy to follow, easy to read. She does a great job at breaking it down for you to really follow her and understand the basis of her research. So the study also found that nearly 2/3 of those who survived, who were surveyed, experienced at least one event. So that's significant. Out of 17,000 people, 2/3 of them experienced at least one adverse childhood event. That's very significant. And it's really been helpful for physicians. You know, a lot of times there used to be a great divide between social work and psychologists and the medical profession. And as we're all, you know, doing our own research and recognizing that we all work together, because things like adverse childhood experiences affect all of our fields. You know, it affects our patients in different ways. So when we're all on the same page and looking at, you know, the biological and psychological social effects, and how that impacts our clients. It just enables us to be able to give, some really comprehensive care. So one quote from Nadine Burke Harris is shortened, but it basically says toxic stress response can occur when a child experiences strong, frequent, and or prolonged adversity without adequate adult support. So we're going to talk about, when we talk about coping mechanisms, think about that. You sometimes wonder, you may see families where their children are being raised in the same exact household, and one child may respond completely different from another child, and they've experienced a lot of the same trauma. A lot of studies have shown that one child who quote unquote made it may have been involved in sports, and had a coach or someone who believed in them and who supported them, or maybe it was a teacher or a professor or a social worker or a principal, an aunt or an uncle, someone who was able to give them that adult support. That makes a huge difference when experiencing those things. And so that can in turn increase the risk for stress-related disease and cognitive impairment well into the adult years. So that's very significant to remember in looking at that. So, we've talked about a lot of these things, and I don't, want to be so gloomy. There's some silver lining. We can be able to identify trauma and check in with our bodies to understand what's happening. And I think the easiest thing for me to remember in studying this topic is understanding that our brain's number one function is to keep us alive. And that can sometimes negatively impact the rest of our body, but the brain is driving the ship, and it's like, listen, my job is to keep you alive by any means necessary. So when we look at, some of the ways that our body responds to stress, if you keep that in mind, it'll sort of make sense, why our bodies respond in certain ways. And so you may have heard of the 5 F's, and that's, we commonly, when we think about the F's, we automatically think of fight or flight. Well, there are 3 more. With fight, a response to trauma, with people who sort of respond to trauma in a fight mindset, that basically means that you're there to fight the issue. So if we imagine us roaming the African safari and a lion is chasing after us, those people with that fight response are like, I have a machete and I've got a stick, and we're, whatever, the best man or animal is going to come out of this. And then you have individuals who freeze. And so that's sort of hiding. And that's a biological response that we see. And it was very significant for me to realize how amazing our body is, and that people who freeze, that biological impact, studies have shown that your heart literally slows down to slow down the production of blood throughout your limbs, so that if you are attacked, you won't lose as much blood. You may have heard stories in the news where someone is attacked or experienced a very violent attack, and people like, it doesn't make any sense for them to have survived. They should have lost so much more blood, and that's because the body is saying, okay, this is too much for us to deal with, and this is how we're going to get out of this. So those are the 2 most common responses that we hear about. But then there's also figure. And that's the plan. That's the person who sort of looks around and says, okay, the lion is coming, but there's a tree over here. If I move fast enough, I can gain an advantage and get at the top of this tree and swipe down, So that's more so coming up with a plan and trying to figure out how, you're going to get out of that situation. And then you have feign, and that's the surrender. It's very similar to freeze, but it's the surrender before the fight in order to avoid the fight. So that's the person who's always looking out for the lion. And the minute they hear a rustle in the trees or whatever, it's like, let me get out of here to even avoid it altogether. So, understanding those different ways that our body responds is significant. But, the bigger thing for us to understand is that fear is sometimes healthy. It becomes traumatic when that fear continues. So to see a lion and fear for your life is a perfectly normal response. I would, go on the verge and say that it's a very smart response to realize that I probably shouldn't approach this lion, And so fear isn't always bad. It becomes traumatic when you get stuck there. That's the trauma, is when your body experiences that level of fear and it's difficult to change and move out of that. So, that's when we start to see some physical responses to trauma. And so, paying attention to our bodies. I know when I start to get stressed, I don't know if you guys can hear it, but I have waterfalls in my study. Having the elements around me helps a lot. I typically have the blinds open. If I can't get outside, they're covered now so that y'all won't have any lighting issues today and watching. But just being able to pay attention. A lot of times you can feel stress like in your neck, in your shoulders. You literally have, you hear like massage therapists say they'll massage people and can feel like knots of tension and things like that in their bodies. And that's our body saying, I'm doing the best I can to deal with this, but I'm going through a lot. Change in appetite is significant. Some people's appetite goes up, some people's go down. Change in sleeping habits, same thing. Some people will go into a depressive mode and sleep in more, while others can't sleep and experience insomnia. An exaggerated stress response. And this one is always interesting to me. I know you all may be familiar with the term doing too much, doing the most. And so I have teenagers and they'll often tell each other, you're doing the most, do a little bit, a little less, and so a lot of times we just sort of write that off of this person is doing the most. But someone who has experienced significant trauma can have an exaggerated stress response. And so that may be the person who's startled very easily. And you're like, seriously, that wasn't that big of a deal. But their body is like, wait, threat. And it's immediately reaching out to one of those 5 F's in order to stay alive. Remember, the brain's responsibility is to keep us alive. And so you may see that. The intrusive memories. And a lot of times when you see that, see the intrusive memories is when we start leaning towards post-traumatic stress disorder. And it's when those memories continue and are present for a significant amount of time, and it's difficult for you to get away from them. So I'll move along because I want to make sure that we talk about how to cope with trauma. You've heard all of these things about it, and it's like, okay, so what do I do? Mindfulness is very, very, is a very significant tool for you to have. It's something that you can do for yourself. And it's literally just sort of pausing, like, when you find yourself being stressed, as I said, mentioned the waterfall to you guys, I no longer heard it. I know that water is very soothing for me, so I keep it going literally 24/7. So I'm getting that positive impact, whether I'm paying attention to it. But our brain, again, its primary focus is to keep us alive. And so it will sort of shut out things. Like, have you ever been talking to someone and then somebody else is having a conversation in the background and then they call your attention and say, hey, did you hear that? And it's like your brain is able to rewind it back and be like, yeah, I actually did hear what you said, and you can repeat it. Yes. It's like, there's all this background stuff going on, but our brain will just sort of shift our focus where it needs to be. Mindfulness allows you a chance to get in control of that. So just sort of taking a moment, whether you want to close your eyes or not. And I like to focus on my breathing and just pay attention to my surroundings, pay attention to your body. If you're in a situation and you start to feel a little off and feel like something's not right, literally check in with yourself and say, okay, what's happening right now? I don't know if everyone here is old enough to be familiar with Cat Williams. I'm not endorsing him because I don't think his stand-up is PG-13. But one quote that I love says, be in tune with your star player. And that's you. Understanding what is a difference for you, because again, trauma is subjective. So what's traumatic to one person may not be for another, but your body knows what's traumatic to you. So checking in with yourself when you're feeling stressed and just saying, okay, what's up? What's going on with me? If you notice your shoulders are tense, pay attention to that and purposely relax them. If I'm really stressed, like if I've got a tight deadline, I tend to clench my jaw. So paying attention to that. A lot of times we just sort of treat it. You hear people who grit their teeth in their sleep and they may just wear a mouthpiece, but it's like, okay, let's pay attention to what's happening to make our bodies get so tense. Meditation. I hear a lot of people say, I can't meditate. I can't turn my brain off. There's just too much going on. And you just have to talk back to it. You literally, even, and meditation doesn't have to be long. You could dedicate anywhere from 2 to 5 minutes. When I first started meditating, And I see I have a typo here. I have, so, but when I first started meditating, I would just take the first 5 minutes of my day before I got out of bed. I literally would just pause before I woke up, before I look at my phone. We're going to talk about that in a second. And just take a moment to check in with my body, check in with myself, set my intentions for the day, review my to-do list. And so at nighttime, that's beneficial as well, especially for people who have a hard time initiating sleep. If your brain is steadily rattling off it's helpful for me to keep like a notepad near my bed. And so you have to talk back to your brain. When your brain is saying alert, 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 and you're trying to ignore the alerts, it just doesn't work that way. It's like if you turn your phone on silent, it doesn't stop the notifications. So respond and say, okay, I hear you. I'm writing it down. I'm writing out a list of everything for me to do tomorrow, and I'll make sure that I stay on that. If this gets to be a bit too much for you, therapy, is definitely beneficial. There are several different types of therapy that will address it. And a lot of it is it's based under trauma-informed therapy. And that could be given in many different ways. There's expressive writing, there's music. I literally have a playlist for everything. I have a morning playlist, a going to bed playlist. I have some mindfulness tracks that I play when I'm sleeping, creating sleep routines, not doing certain things in your bedroom so that your body recognizes that your bed is for sleeping. So I don't do work in my bedroom. My laptop doesn't come to my bedroom. Eating, a lot of times when you've experienced trauma, I hear clients who I literally just forgot to eat, and before I knew it, I was sick. I wasn't feeling well. I was weak, and things like that. So actually setting a sleep schedule, that has been very helpful. Set an alarm and say, eat something. I don't care if it's a handful of cashews or almonds, something, just to make sure you're giving your body the nourishment that it needs. And so this here, another really important thing, and it's something I tell my teenagers as well, is that in case of emergency, contacting your phone, because a lot of times we don't know how we're going to respond to trauma. You want to be prepared. So that I make sure that's set in your phone. If hopefully you don't experience it, but if there's ever a traumatic experience to where you just literally cannot be present in that moment, having that on your phone helps emergency responders as well as anybody who's with you. Limiting screen time. I do not check my phone 2 hours when I first wake up. And I know this is big, y'all. I know y'all are probably like, okay, I was with her until she said this. But limiting your screen time, being very conscious of what you take in. So I give myself 2 hours when I first wake up in the morning and 2 hours before bed. And that's so that I can be in control of that. And actually, it's something I heard from Oprah that really helped me a lot. And so my teenagers don't like that I've, put that rule in place, but we're all going to figure it out. And monitoring social media. I ask myself, there's so many videos that are circulating the web right now, especially as it pertains to police brutality. And while it's great that we're able to have our cell phones there to record these things, to call attention to justice, it can be very, very traumatic, for lack of a better words, for those of us who are watching those videos. So filter it. You can advocate without having to subject yourself to that trauma, because that's an example of secondary trauma, having to consistently feed that into your system and finding your joy. Being very purposeful. I think, one thing that's very beneficial is stimulating your senses. So if there are smells that you love, like I love patchouli. So a lot of oils that I diffuse have patchouli in it because it makes me feel good. So figure out what makes you feel good. What do you like to see and smell? What do you like to listen to as it pertains to music and things like that? So, and refer back when you think about, being in tune with your star player and knowing what you need and just sort of getting ahead of that. That's that finding your joy and being purposeful. When you take those few minutes at the beginning of the day, you really just sort of give yourself a moment to set your intentions for the day.
Miss Crowley, thank you. Okay.
Yes.
We are approaching 1 o'clock, but I just want you to know that in the chat, you have been receiving some wonderful comments. A lot of people agreeing and mentioning the things that they do in church. And I know I'm over here with at least 3 pages of notes. I'm going to go back over those 5 L's and limit my screen time, because Instagram do allow you to do that.
Yes.
If you go into these settings, they'll let you know how long you've been on there. But I want to thank you so much. I know some people asked if we'll be sharing your deck. And so I just want to say, yes, we have your permission to share that information.
Yes. And please save this number in your phone. I know you guys will get it, but this crisis and access line, the suicide line, those two. So if you can screenshot it or take a really quick picture, save those into your phone. You want to make sure you have that in times of crisis. But thank y'all so much for having me. Really a pleasure.
Thank you. And you're definitely going to stick around and be in the chat. Everyone, we're going to get ready for our next presentation. Thank you all for your patience.